Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dalia Kokash. I am the content manager of the College of Health Sciences Student Association. Welcome to the first installment of Health Heroes, a series where health professionals, students, and patients bring their stories and experiences to the stage to inspire and motivate. In collaboration with the Qatar Cancer Society, as well as the College of Health Sciences, today's event was planned and organized by our student association, whose mission is to promote social and intellectual mutuality among members, encourage scientific exploration, and cultivate professional skills and competence. Our team has been looking forward to this day for many months now, and whether you've joined us online or in person, we're grateful to have you with us. As students who, inshallah, will go on to have careers in the health domain, we carry the responsibility of caring for other people's lives. And though it is a great honor given to us by God, I think it's fair to say that it's also quite scary. The closer my classmates and I are to graduation, the more clearly we see the gaps in our knowledge, and the more vividly we feel our lack of experience and our shortcomings. So we've set up this platform for people who we believe can help us fill those gaps in. For knowledge and experience, we will look to our seniors, doctors, researchers, professors, and other health professionals who have paved the road for us. For motivation and humanity, we will look to the communities and individuals who rely on us for their health and well-being. And for a sense of unity and support, we will look to those who we can relate to the most, our peers and colleagues. All of these people are health heroes in their own capacity, each with a unique pearl of wisdom to share. And it is our sincere hope that each and every one of us will leave this event with something special. The cornerstone of all this, of course, is the Dean of the College of Health Sciences, who has been supporting, guiding, and encouraging us to move forward with our initiatives since day one. Please help me welcome Dr. Hanan Abdulrahim.
Good morning and welcome to everyone who is joining us in person and online. I want to thank you for the tremendous honor of inviting me to be part of your event. I think those of you who come to see me in my office or who meet with me on campus know that I always say that one of the best parts of my day is when I'm dealing with students, because it reminds me why I'm here and what my work is all about. And I think that this is exactly the kind of event that will remind you why you're here and what your purpose is all about. I know that in the midst of exams and clinical practice and projects and deadlines, it's really easy to forget sometimes the bigger picture and to even forget why you were doing this in the first place. But you were doing this because you are future scientists and carers, and because you care about making your community better and the lives of people in your community better. And what better way to remember this than to hear inspirational stories? This is what I really like about the theme of this event, is that by being inspired, we renew our energy to power through the hard work and to do what we need to do to get to the end. And the end, like I always say, is a moving target. You will always be learning, and you will always be inspired, and you will always be looking for new ways to help. I am very, very, very proud of the CHSSA. I am very proud of your thinking and your planning and your initiative and your care and your creativity. I welcome our guests. I can't wait to hear their stories. And I thank you once again for allowing me to be part of this event.
Thank you so much, Dr. Hanan. Next up, we have a special guest joining us from the Qatar Cancer Society. He is the head of Professional Development and Scientific Development Department. Let's give a warm welcome to Dr. Hadi Abu Rashid.
Thank you so much, guys. First of all, want to thank the College of Health Study Sciences Student Association for the invitation, and actually I want to add also I'm proud a student of College of Health Sciences. I'm actually doing my master in public health, so it's a great honor to be. Actually, I'm a member in your student association. I follow your activities, but unfortunately, because of my busy schedule, sometimes I cannot attend most of your activity. And it's actually an honor to follow Dr. Hanan in this event. And it's actually all of us honor is actually to be in your presence, Ms. Shaunna. We all doing this for you. And so this is actually, I always say this till everyone I meet, we learn from you. Actually, every day and also want to kind of add on what Dr. Hanan mentioned that among of the busy schedule, sometimes we forget. But this is what's actually push us forward and to motivate us to do more, and actually not only in serving people living with cancer and making their journey and a better quality of life. Also, the other aspect is actually improving our knowledge in science and education. Don't underestimate the importance of research and investing the time in educational activity and academic activity. All of this matter. And I'm gonna kind of touch base on points dear to my heart is the concept of personalized healthcare and cancer control and equitable format. So a lot of people will say, why we are talking about personalized healthcare? Why it's matter? Because I want you to take a look at this. When you see this, what do you think? Nothing clear. Like we are, working with the serving people living with cancer, but nothing clear. It's a vague picture. We don't know that much about them. But actually, when we work with people living with cancer, this is how we need to see it. This is how clear. We need to have many information. We need to understand their need. We need to provide them care in a high definition. Nowadays I don't know, maybe there is, I'm not that tech savvy. Now there is high definition. Maybe there is this is how detailed we need to provide the care and understand them, not in HD, maybe in higher level of this. And if you guys look at the left, the focus on this is the old focus of care. Diagnosis, treatment. That's all what we previously think about. But that's not should be the case. We need to move on to the next. We need to understand for every individual living with cancer, we need to provide them with selected care according to their need, specified for them. And it's not only diagnosis with treatment, it's also prediction and prevention, moving also to the early detection and diagnosis, the concept of selective treatment and therapy for people living with cancer, and also the other aspect of personalized care, rapid access to healthcare, personalized healthcare services. And I'm going to touch base on this aspect, and also the digital health and using tool. This is the new generation of actually, and we are actually obligated to provide the best services for people living with cancer. So what does this mean for people living with cancer? Is actually we want to treat them as a person, not as a condition. And that's why in the Qatar Cancer Society, we don't use the word cancer patient, we use the word people living with cancer. And we want to give people more choices and more, so they feel they are in control of their management, not just, they are being dedicated to the treatment plan. And not only treatment, all aspect of care. And we want them to be, that's the aspect that I think we feel that Qatar Cancer Control reached the first two aspects. I'm confident about it. But the third point, we need to do more of this. We need to involve the people living with cancer in decision making, in managing their care, not only at the individual level, at the country level. So what the overarching role that cancer civil society could play a role. And I mean, and I'm talking about Qatar Cancer Society, but you could apply this to any organization that working in cancer control. They need to think of personalized health. They need to spread the awareness of personalized healthcare. That's concept, and that's also actually part of this event, that you guys are the future healthcare provider. You need to be aware of concept personalized healthcare and start to think of it in implementing every aspect of your studies and maybe your project. And then we need to improve the access to personalized healthcare. And the third aspect, that's where all the advocacy and you guys as a future decision maker in healthcare in Qatar, we need to have the healthcare system empowered and actually planned by the insight from people of living with cancer. So kind of I touch base on this, but we, in every aspect of those steps, or let's say major milestone in the cancer care continuum, we need to have patient engaged in every aspect. We need to get data and insight from them to take decision in every aspect of it. So let's talk about prediction and prevention. So what does this mean for people living with cancer? It means that, and here I'm gonna kind of mix between what Qatar Cancer Society doing currently and what's our aspiration. So what we are doing currently, and actually this event we could consider it, is a community awareness event of cancers and signs and symptoms and early detection, and the importance also of the journey and the management of cancer control in general. The other aspect is the continuing medical education, and I mean, you guys are in the actual active medical education now, but also after you graduate, that's something I want to, I mean, you mentioned that how scared you are from the moment of graduation. Actually, you have to think how you should maintain your level of education after you graduate, because that's one of the things that people graduate and they said, okay, I'm done with schooling. I'm done with reading articles and checking the updated information. That should not be the case, because continuing medical education is essential in cancer prevention. Because you need to know what's the evidence, why I'm recommending this as a healthcare professional or public health educators. I mean, everyone give advices on do and do not, but you need to know the evidence. You need to know it from medical educational perspective. And also the financial. Well, here, this is more related to Qatar Cancer Society. We play a role in cancer prevention in the financial support for genetic testing for family with people living with cancer. There are certain type of cancers, they are dedicated with clear genetic pathways. And that's where we, as a Qatar Cancer Society, we support them with the financial support to be able to afford the cost of those genetic testing. Now let's move on to detection and diagnosis. The community awareness of cancer screening early detection, especially Qatar University has been collaborating with, actually on an annual basis with Qatar Cancer Society on the awareness of breast cancer. And we really appreciate this because it's important. The university by itself, it's a huge ecosystem and we need to spread the awareness among them. Also providing breast and cervical cancer screening services for the public through our collaboration with the private sector. It's available through the government, but also we provide through the private sector because we believe that all sector of health need to play a role, not only the government. And the third point is the continuing medical education for healthcare professional in the area of early detection of cancer. Because on average, healthcare professional, they may see each in the primary care, they may see like maybe 1,000 to 1,500 patients per year. In that, they will see maybe 2 or 3 or 4 even cancer patients. So they really need to be educated so they keep their radar high and they keep themselves aware that could happen and they need to keep their information updated. What are the signs and symptoms? What's the proper referral process of suspected cancer cases? Personalized therapy and care, and this is also the first role is actually Qatar Cancer Society through the support of the generosity of the corporate and the people in the state of Qatar, that we are being able to be the median between the donors and the people living with cancer to help support them financially in the therapy fees. And the other aspect is the disease-based support group. It's very essential and important. It's okay. Do you want us to stop a little bit? Okay, I know. Take your time. I know sometimes it's the whole living. I mean, I understand. It's living the journey over and over. I understand this. So if you at any moment you want us to, let me know. Okay. So the disease support group is important because they actually play a role in pushing the improvement of the care. Because they push forward and they advocate for improving the care. And the other aspect in personalized therapy and care is the research. And here I want to stress on the importance of your work as a future researcher and scientist. Research, database, registry, outcome of treatment, and choosing the better treatment. And I'm actually where I think I've seen the outcome of that study a few months ago. One of the graduate student, one of the master student, pharmacy student, did the great project in pharmaceutical economic and how you choose treatment versus the other. And that's actually, it's gonna help the future of choosing the better treatment for in the state of Qatar. So that's the future for you guys. And the rapid access to personalized healthcare, how are we gonna do this? By awareness, by education for the public, for decision makers, and also by providing this service and getting the insight from people living with cancer. And here, actually, where the area we want to we aspire as Qatar Cancer Society to move forward is we want to do really, we need to put insights and collaboration. Patient-reported outcome all over the world is actually essential part in managing and deciding which care we go forward with it. This area still need improvement. And actually, we have the digital platform. We need to connect ways, a digital way, connect patient-reported outcome directly from the tip of their phone to their medical record. Now we all have My Health. We could access the lab. But the future, it need to be moving that way. And Qatar University, I'm proud that you guys are leading a lot of effort in artificial intelligence and healthcare. And that could be one of the future projects in pushing forward using the technology to maintaining this mainstream connection between patient and their healthcare provider, that they actually dynamically report their outcome of the treatment to their healthcare professional. And the wearable devices, I mean, there is now a lot of development in actually using wearable devices as surrogate for the mental and the psychosocial well-being, for even physical well-being for people living with cancer. So that's another area also for growth and development. And that's actually all research. Because, I mean, the point of care, the point of contact between people living with cancer and their provider is minimal. I mean, they just see that patient. But we need, with the technology we have now, we could actually, healthcare provider, the oncologist who was managing the care, they could have with those wearable devices constant access and constant data about how's the well-being, is the sleeping hour disrupted, is the heart rate constantly elevated, there is sign of fatigue all the time. And that will tell us all about the impact of treatment. So together we need to realize personalized healthcare, and I call it actually cancer control. We need to work together for better outcome. We need quality of life. And this area is a major point. We need to focus more and more, and our management should be driven and program driven by quality of life. Empowerment for people living with cancer, their voices, their opinion need to actually set the tone for our program. And definitely we need financial investment and support and societal support. And here the role of Qatar University, you guys, in addition to the research and the education, also societal, you set the tone for the society to be involved. And I mentioned, we kind of touch base on the personalized healthcare. Equitable person-centered cancer control is essential. And equity, it means that we need to give everybody what do they need. Doesn't mean that giving everybody the same. Because I may need something different than the others. Or like, it's not I may, actually, my need is different than the other. So we need to always think of equity versus equality. Equality means they are all, or inequality, they are all equal, but this is different perspective. The equity mean if there are factors that actually leading to that we could change it. I mean, there are things like female have tendency to have, breast cancer more than male. That's not, we cannot do nothing about. This is something we cannot play a role in it. But women from different socioeconomical status, they have different level of health literacy, different access to health literacy, different access to healthcare services. So that's where our role as a society organization or the society in general, we need to maintain that they're having equity in access, not only the service, care service, to education, to literacy, to support, all of that. So in Qatar Cancer Society, we have this framework. We've been ensuring equitable person-centered cancer control. We've been maintaining, trying our best to everyone have the same access to diagnostic therapeutic services. We've been promoting navigation to cancer screening service. We've been working in community cancer awareness activity for all people from different nationality, different ages, different backgrounds, and psychosocial support and education for people living with cancer. And the aspect that is dear to my heart is the capacity building for health workforce in cancer control. And part of that program is the part that I'm honored with it when we have Qatar University students from public health actually come over and do their field practicum with us. It's one of the part of my day that actually always push me forward to learn more, to be able to answer your questions. You guys always come up with a tricky question. And also advocacy for people living with cancer. And that aspect is actually, this is one of the areas that we need more in our region, is working in the advocacy and actually building the capacity for people living with cancer to deliver their voices concerned to decision makers. That's one of the areas that actually future need more effort in this. And knowledge translation and research. And I'm talking about knowledge translation. One of the things that I've noticed, in Qatar, we have a lot of research outcomes and publication and efforts, but it's not being translated in a language that people living with cancer understand. So that's actually one of the areas that we need to focus more on, is that translate this knowledge in a language they could read, they understand, and they build their decision making on it. And I'm just saying that if you guys see the workforce development is the foundation for all. This is National Cancer Framework patient pathway in state of Qatar. And if you see, guys, the workforce development is the aspect of everything. Not only building the capacity for oncologists and let's say radiotherapy and all of that, but also the primary care, because they are the one that they suspect the cancer. If the cancer did not get suspected and referred in a proper time, let's say referred in a later stage, the outcomes will be completely different. And this is what I'm mentioning, the importance of primary care. The earlier you diagnose the cancer in the earlier stages, the better outcome and better quality of life for people living with cancer. And this is actually area for research question. You guys, as a future researcher, or even now in your current stage of education, you could collaborate with us. And we are already collaborating on the quality of life for women living with breast cancer. And we are honored to have Dr. Hanan, and we are in this project, and the rest of the team from QU. And also, not only breast cancer, we need to do more project. We need to do knowledge and attitude perception of all aspects of cancer care, from all perspective, from perspective of the people, public, from perspective of the people living with cancer, perspective of healthcare professional. And that's one of the area is there is a, we need more and more of understanding the primary care of their perception of healthcare. Like in a quick example of to make sure that everyone understanding importance of HPV vaccination for cervical cancer. I mean, that's one of the things that you could actually, the research was done in the region, the big campaign was done in a neighboring company. The public start to be very open and they want to actually go and get the vaccine. And when they go to the primary care tells them, you don't need them. So because the knowledge and attitude at the primary care was different and there was no research about it. So it's a very important topic to understand the knowledge and attitude, perception study of healthcare professional, and the professional burnout. Unfortunately, in the oncology world, the burnout is very high. You would see huge burnout among the professional working in the oncology. Advocacy and empowerment for people living with cancer. What the public, what's their understanding of empowerment and advocacy? And also monitoring evaluation for our program in the cancer awareness and the people living with cancer support program. I mean, this program, Health Hero, I'm sure you guys have a plan for monitoring evaluation. What's the ultimate outcome you're gonna have? So this is all take it further step than just people satisfaction. It has impact with their people actually come up with a project after this activity or not. And also one of the things is measuring the people understanding of the rights of the people living with cancer, their right to go back to work, their right to go back to school. That's an important topic. And cancer burden. Need assessment for all kind of continuing professional education, need assessment for people living with cancer, and I mentioned knowledge translation. And we need to involve people living with cancer in every aspect in research. They need to move from participant to partner. They really need to be part of a research activity. And also the data, we need more data. This is just an example of the cancer type of people living with cancer that we are serving in Qatar Cancer Society. And you see that blood cancer is I mean, this is all very on their need. That's why I would tell you, if you look at the Qatar data, Qatar national data, it will be breast cancer on the top. But this is our data, whom we are serving. So that's why we tell you the importance of the data and understand data from our perspective. Thank you so much.
Thank you so much for that, Doctor. If anyone has any questions, we do have a Q&A session after this. So you can type them in the chat if you're online or just prepare your questions now. So up next is the president of our student association. She's currently completing her biomedical sciences degree with an internship at Hamad Hospital. And our main story today actually begins with her walking to the garden in Al Aman Hospital one spring-like morning. Please welcome Asma Hassan.
Assalamu alaikum wa rahmatullahi wa barakatuh. Dear honorable attendees, the Dean of the College of Health Science, Dr. Hanan Abdulrahim, our guests from Qatar Cancer Society, our special guests from different health fields, and our hero of the day, Ms. Shaunna, Qatar University students, faculty and staff, and all our attendees, whether in this hall or through our YouTube channel or WebEx. It's a true pleasure for us to welcome you all to our ceremony in this special day. One of the CHSSA Student Association goals is to establish a link between a health institution in Qatar and Qatar University, which support its policies and strategies for achieving national health goals. And arising with this goal, we are honored to present the first episode of the series Health Heroes. And the main objective of the series is to present an inspiring health hero who have overcome obstacles and achieved their biggest dream throughout their lives, and also aim to give all of the students and guests the opportunity to know their strengths and abilities which allow them to overcome the most difficult challenges to achieve their dream and to discover the secret step behind this tremendous success. There are many successful individuals in this life, but those with the remarkable success are the ones who face the most difficult obstacles and challenges. They are the ones who fight all the difficulties they face through hope, patience, and faith in God to make their dream come true. Today, we will be taking you through a delightful journey by sharing one of the most beautiful and outstanding stories. It's a story about fighting one of the most fatal diseases in the world, which is cancer. As a health profession students, we have one goal, which is providing healthcare to the patient. We should find a various way to provide the healthcare which are not limited to giving medicine or medical procedures, but by finding other ways that make the patient happy, keep them motivated to stimulate their immune system, which empower their ability to fight and recover. Therefore, we are honored to present to you the hero, Ms. Shaunna, who I have met in Al-Amal Hospital, specifically during my internship program. While I was searching for an inspiring speaker with my team, Shaunna was searching for a place that can make her dream come true, which she has worked so hard on. And that dream was giving her the opportunity to share her story about the effort during fighting cancer in front of everyone, before death steals away this opportunity. She prayed to God to send her someone who could help her to make her dream come true. In that moment, I realized that no matter how big or small the changes we go through are, whether they are planned or unexpected, there is always divine wisdom in them, even though we may not understand all of it now. If anything had gone differently, Ms. Shaunna and I might have never met. But God's fate had led us down the same path so that we would meet at the exact right moment and the exact right place. I was brought to Ms. Shaunna's side so that I would help her achieve lifelong dream. God really does work in mysterious way. I can't express how grateful I am for everything, for every joyful moment, difficult situation, and for all people without exception. I thank God for the way He sent me to her, to be the person appointed to open the door for someone like Ms. Shaunna. A hero in her own right is really an honor I never would have thought possible. So now, by God's grace, the dream became true. Ms. Shaunna, the stage is yours. Go ahead.
So, as Asma, our keynote, as Asma mentioned, our keynote speaker is not only a beacon of hope to others struggling with disease, but she's also a source of motivation for us as students and future health professionals to work with diligence and intentionality. She is a representation of all those in need of medical care. Please help me welcome Ms. Shaunna Uy.
Praise God. Good afternoon, everyone. First, I want to thank you all for coming, doctors, Sir Asma, and all of you here, the students who prepared this event. I'm with a grateful heart that I don't know what to say, but thank you. So I think you've been asking why I am here. It's okay, it's okay, I will stand. But then maybe I will sit down. This is me. In front of you is a stage 4 cancer, just a fighter. Let me tell about the story, what is the reason why I'm here now today. Asma, she's an angel. I had a follow-up checkup with Dr. Muhammad Sair in National Cancer Research Hospital when I decided to go to a coffee shop because I had a sick leave that day, so I will not go to work. So I decided to go to the coffee shop. Let me show you this book. Hi, this is with me. I'm always carrying this with me whenever I want to write something about my journey. So I decided to go there and have music in my ears, a godly music, and I was starting to write my another episode of my life, and she was on another table. I don't know her. I even didn't look at her. So when I finished, I started packing up my stuff, and I heard her asking me something. I said, "Sorry." She said, did I disturb you?" I said, "No, no, no." I was thinking why she will ask me if I disturb her. I'm already going. So I told her, "No, no, it's okay." She said, "Are you working here?" I said, "No, I'm a cancer patient." So I guess she wanted to have a conversation that day, and I said, "Maybe God, this is your purpose for today, why I'm here." So I sat down beside her, and we've talked about our own struggles and how we've been optimistic in life. And it was so amazing meeting someone from a different nationality. Even I didn't expect that she will talk to me. And we've been talking about our own stories, and we've ended up crying and hugging each other. And she was kissing me, and "I love you, I love you." We've been talking about everything. And then the next question surprised me the most. She said, "Can you speak in front of people?" Aladol, I said, "Yes." That was my dream. I envisioned myself in speaking in front of crowd, but I don't know how. And that day was the answer of my prayer. She was the angel that was sent from God. So that's the reason why I am here now. And thank you for the opportunity. And I believe it is God's will. He appointed the perfect day, the perfect time that two people with the same purpose. Me, I want to share my story, and she was looking for a person who has a story to tell. So that's where it started. Let me tell you a short story of my life. I was raised in a small city of Catbalogan in a simple life. This is the only picture I had when I was little, because it's really, we're poor. Yeah, I remember how my mom used to, we have this rice, a large amount of rice, just to be full with with small amount of fish or vegetable or meat, sometimes only sugar added to that, or soy sauce. But we didn't complain about life. Even we praised God for the blessings we received. Sorry for that. This is my mom, my papa, and I have three sisters and three brothers. And we've been living a simple life, but we are thankful of God. Sorry. On 2014, this was the time I was first diagnosed with cancer. This is the picture in PGH, the Philippine Government Hospital, where it is really, it is a hallway, like a big room, a hallway, and all of the patients are right there. These are the doctors. They are the doctors. One of which, this with the yellow, he was there during my surgery. This is a few hours after my operation. They excised an 18 by 16 size tumor in my stomach that I have been enduring for like 3 to 4 months, and it's really painful. The pain of that cancer, I cannot explain how painful that. If I eat even soya small, I would vomit and vomit and vomit. But God has been with me, that I never have given up. So this day that I survived the operation, I told myself I still have a purpose. That's why God gave His miracle. So my oncologist that time advised me to undergo chemotherapy, but I refused. Honestly, I refused because I was afraid of chemotherapy. I know the effect of chemotherapy in the people, and not just that I am afraid, because I don't want to be a burden to my family. You know, my brother, he already sold his house just to provide me financially in my operation. So I said, no, I will not take it. It's so expensive. So I decided to go back in my place. Having the positivity, I said, God, this diagnosis, it's just diagnosis, but it will not define my life, and I know I still have a purpose. So use these remaining days of my life to do your purpose. And true enough, this is a picture of after having the operation. God brought me to a school where I was able to continue my unfinished college. This is the picture of my team. Like Asma, I was the president of the student council in summer college, and I asked God to use me in this situation, to give Him glory, to share the people how I fight, to share my story to people, and praise God, I inspired many students, even teachers, when I told about my story. But then again, I cannot finish again. I cannot finish my study. Why? Because of my sister. She was the reason why I am here in Qatar. She had the same illness like I did, on the same spot where it's starting. So the doctor advised her to undergo a surgery. And I know how painful it is. I know she's afraid. So I had to come here. I decided to come here to take care of her, to give her encouragement. But God is so good that after the surgery, the result was just benign. It's not cancer, just I had. So we praised God for that. And then a while, after a month, she recovered. And then we decided, my sisters and I decided that I will stay here. And luckily, I found a job as a receptionist and insurance coordinator in a private medical center. These are pictures of my friends. Two of them are here now. And then after a year, my sisters advised me to go to Hamad Hospital to have a checkup. It's been a long time I didn't have any checkup. So I had a random test, the blood test, CT scans. I cannot count how many CT scans I had, PET scan, MRI, endoscopy, everything they did, the Hamad Hospital did, and the result came with unfavorable declaration. My doctor said at the time, do you really want me to speak it in front of your sister? He was asking my sister because she's a nurse. She said, yes. Stage 4. My doctor said, I cannot explain how I felt that time. It was just, we ended up laughing with my sister. It was the only thing that came out of her mind, just to hide the, the pain inside. It's my two kids. The first thing that came in my mind was my two kids. I said, I was afraid. I was worried that I could not see them. I could not guide them as they grow. That fear was, it was devouring me inside my room. I did not go to work. I was crying like half day. Not because I'm sad that I had a cancer, but time I was thinking of them. And I was saying, Mama, 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 only these words I keep on saying, I wish she was there. But you know, God is so great. He sent a rescue that time, same day. I met an old man, and then he advised me. I realized that day, why will I worry that I will die of cancer? Do I have any contract with God? Did I sign any contract that I will die in this day? No. I could have died today. I could die tomorrow, another day. Why will I worry? Why will I stress myself thinking maybe I will die after 6 months? Supposedly I will die today, what I will do? It was an awakening message that took all of my worries away. It's like a wisdom from God. And then I realized I should live today as if it's my last. So I need to thank the people who helped me. I need to show love to the people who love me and forgive the people who have who've hurted me. So I learned how to appreciate life. And from that moment, the fear turned to trust, the loneliness into joy. And I thank God for it. I said, okay, Lord, I will accept this challenge for the second time around. Let me know your purpose in it. My doctor, Dr. Muhammad Sayer, again, second doctor oncologist, advised me to undergo chemotherapy, which is what I've been afraid for. But he has this convincing power that I was able to say yes. So at first, I had this Gleevec, the chemotherapy field. I said, okay, I will try. And after like 1 to 2 weeks, I've been taking the medicine. I ended up in an ambulance. I went to the emergency room and I've been enduring the muscle pain and stomach pain and vomiting for 3 days that I thought that it will go because I had this medicine, the painkillers, but it didn't. So I was in the emergency room for 2 days. They had me CT scan, and after the result, they said that I had to stay in the hospital. And they found out that I'm already having an internal bleeding. So we waited for the doctor's order. I stayed there. I felt heavy that time. Whatever position I am in could not put me at ease. My sister would massage me. I sat down. I laid down. It couldn't give me ease. I said, what's this? And I felt like I cannot explain. But I remembered my mom. They didn't know. I I decided not to let them know about my situation. And that moment that I felt, oh my God, maybe it's I think I could not make it. I can feel it inside me. And whenever I remember of my mom, my heart is aching too much. It's so painful. And whenever I see I have my two sisters there at that time, I don't want to see them sad. So I tell them, yalla, eat, go. If I see them happy, I relax. But deep inside, really, I don't feel good. How many hours have been waiting for 6 hours until I could no longer hold. I told my sister, I don't feel okay. After saying those words, I had this vital signs machine. I don't know what you call that. It started to it's like in the in a movie scene. I started having this heaviness of breathe. I cannot breathe. And I feel so heavy. So the doctors and nurses, they started to came in. They started to, it's like I was like, oh my God, it's my deathbed already. Then I was doing this to my sisters. Please pray for me. They didn't. They were afraid. They were just crying. And I remember my brother-in-law, Kelvin, who was in the same situation before. I was there and beside him. I was praying for him. I did not have given up until he was unconscious. He also had this bleeding. So I was expecting my sisters to do the same. But they just kept on crying. I said, oh God, it's true. I said, oh God. So now it's been between you and me. So I closed my eyes and I go back to what he promised me. That the end of my life is victory. And from that moment, he promised me, I believe that. And I said, it is not yet finished. So I encouraged myself once more. I closed my eyes and I remember to sing a song. I cannot breathe. I have this oxygen and my blood pressure, it was really on downfall and it became high and I cannot understand. And my heart rate was 149. I could feel it. It's like going outside already, my heart, and it's painful. And I cannot breathe. I said, no, it's not yet finished. I said, why would God bring me here in Qatar just to die? No, I said, no, I have a big God. And I remembered to sing a song that really helped me all throughout. I cannot breathe, but I chose to sing a song for Him. I sing for God. I continuously sing, and I was like, I'm singing, I'm singing, I'm singing. The doctors and nurses saw me that time. They hear me singing, and they're asking me, Shaunna, are you okay? Yes, doc, I'm okay. Praise God, I'm okay. I continually singing. There are 9 nurses who attempted to find a big vein here, but they could not. It took them many hours to find that vein, but they couldn't. They needed to transfuse blood to me already because I was having an internal bleeding, and it's really. But when I started singing, this one lady, she tried again. She said, "Let me try once more." And then it was a miracle. According to this nurse, one big vein suddenly showed up, and that was it. They were able to transfuse blood to me, and after like 10 minutes, they sent me to the CT scan again for they want to check where the bleeding is, where it started. But praise God, the bleeding stopped. And they said I no longer need a surgery for the bleeding. It stopped. So I just needed some time to heal and just to absorb the blood. So I said, God, really, it's your miracle. I'm correct. It's not yet finished. You still have a purpose with me. During the 7 days that I stayed in the hospital, I met this lady. She has a leukemia. She has a cancer of the blood. She was there in the same room. She heard me that time when I was in my deathbed. And the next morning when I was going to the toilet, I was like this. And I saw her there. And I said, can I talk to you? She said, yes, come here. That time we talked not of our sickness. We talk how God has been good to our life in spite and amidst of the sickness. This letter, this is from one of the patients also there. She is in the prison. I don't know what happened, but she was sick that time, so they had to put her in the hospital. And It's giving me courage. It has given me a purpose that I can use my story to inspire, to help others who are experiencing the same pain that I have, the same fear that I have. And through this, I became positive. This is uh, this is what gives me reason to live more. And they are behind. They are the prayer warriors. They have been with me since day one. And I thank them for not giving up on me, for praying for me. It's, see the life, it's very hard. But if you have your loved ones, you have your friends, you have your people around you who's praying for you, and they will not give up on you, you will have that strength. Miracles do happen. And I am a living testimony of that miracle. See, this is me now. Beautifully and wonderfully created by God. You know, life is beautiful. Life is not just for fun or for happiness, for enjoyment. No, life has a deeper meaning. Life is not just for you to study, to have a career, for you to have a boyfriend, a girlfriend, to marry, to have kids, and to stay a mother, to stay a father, to work. Life is not just about gaining power to control others. Life is beautiful. Life is simple. You know, all of us will die. Eventually, we will all die. But the confidence that when the death arrives knocking at your door, you will be confident to face God without fear. Because you know that you did something. You inspired others. It's not just about money. For me, if you will ask me if I will choose richness over having cancer, halas, I don't need that richness. I would still choose to obey God, to have this cancer. Because through this, see, I am here. I will not be here without this cancer. Richness, you will have that, okay? You will be rich, you will have all the cars and jewelries and everything. But for what? Believe me, in your deathbed, you cannot think of those things. Even your family, they will not be there. Only you and God will be there on that time. So we should have that wisdom to interpret life and what really life means. And that is why I'm here today to share with you about God, but it is all about, and it's not about me. I am here not because of me, but because I want to give glory to God who is in me. When she saw me that time, I said, it's not about me that she saw that time. It was God who is in me. It was my purpose who is in me, who keeps me going, who keeps me strong. And that is what I want to share for all of the cancer patients, for all who are depressed, for all who are in pain, for all who are those abused, for all of those who are suicidal. There is hope. We just need, I know one thing I've learned about this life, you cannot change things. It will happen the way it will happen. Surely it will happen. But you can do something. I can do something. From that moment, I said, I can do something. I started to change the way I think. Like this cancer, I cannot change that. It is meant for me, the cancer. But I started to change the way I think. I said, God, give me wisdom to interpret this cancer, to interpret your purpose in this cancer. And now I am standing in front of you telling that if this cancer will help other people, will inspire other people, and if this cancer will give glory to God, then let it be my purpose. Let it be my life's purpose. And I hope you learn something from me, from a cancer patient today. And for those who are watching online, I hope that you will learn to appreciate life and to realize that life is beautiful. And I thank you, doctors, and all of you for hearing me out today. All of you. Thank you. And please give me this opportunity to thank Hamad Medical Hospital, the Cancer Society. They've been so good to me during these days I was in hospital. I don't know if, I wrote a letter to them before, after I was in the hospital. I wrote a letter. I don't know who has this letter now. I thank them because they are very nice. They are the doctors that are coming. I do appreciate it. It's different. You will feel not sad. It's like you are at home. Even if you're alone in the hospital, you will feel at home because of the care. And I thank you all medical practitioners, students who will be doctors, who will be nurses. But then, thank you for the care. I really felt it in Hamad Hospital. And it was amazing. It was amazing. That's why God brought me in this place. And above all, I want to give all the glory and honor to God. It's not about me. Even today, I don't want to be remembered by my name. I want to be remembered by the God who is in me, who lives in me. And may all the glory and honor be to Him. Thank you so much.
Thank you. Thank you, actually. We thank you.
Okay, so today, as a special surprise for Ms. Shaunna, we actually have someone from Hamad Medical Corporation's National Center for Cancer Care and Research. This is Dr. Muhammad Hamid. He is the consultant oncologist at Al Amal Hospital, and he's been Shaunna's doctor since her journey here in Qatar.
Hi, good afternoon.
Hello, doctor. Can you hear us?
Yes, I can hear you very well.
Okay.
All right. I actually would like to congratulate you for this event. This is something that not only me personally, I would be interested to watch and see. I think if this event is repeated frequently with more patients, this is something that all oncologists will really make sure to attend religiously. I would like to thank you, Shaunna, if you can see me well on the screen, for your courage. I'd like to thank you for
Doc.
opening up. I'd like to thank you for your resolve, and thank you for sharing your story. And there is also some note I would like to, I was really surprised by the efforts done by the Qatar Cancer Society. I would like to ask Dr. Hadi Muhammad Abu Rashid if he would honor us in the center and talk, give us the same presentation in the center. I think this is something that I would be personally interested in, and all my colleagues. I would like to thank the organizing committee, students and deans. I would like to thank the College of Health Science, Qatar University. I would like to thank Qatar Cancer Society. I'd like to thank you especially for giving Mrs. Shaunna a chance to fulfill what she believes it to be her true life goal, and that is to inspire people and tell her story. And I think this is the life goal of all human beings. All we want in life is to experience life from a different perspective rather than the daily routine, getting up and go to work and hovering aimlessly through life. is to be able to have a story and to inspire others. And I thank you for giving Shaunna this opportunity. So the story of GIST tumors, which is the cancer that Shaunna is dealing with, is really highlighted heavily in the medical literature. But it is highlighted by researchers, it is highlighted by scientists, by physicians, by people of academia. But the real story of any disease can only, and it should only be narrated by the humans living with it, by the humans who are dealing with it on daily basis from the first moment of hearing the diagnosis to the never-ending patient waiting for an image to be done or a blood sample to be drawn, to the turbulent ups and downs of emotions of uncertainty, sitting with a physician telling the patient that your tumor has grown in size or your tumor has shrunk in size or it had disappeared but now it came back. The ups and downs of hopes, despair, fear, acceptance, to the agony of side effects of treatment. Cancer is and will ever remain an overwhelming experience on patients and their families. But it also, and this is very important, and I think you have all witnessed this today, and we see this on a daily basis during our practice. It comes with a blessing of transcendence. It is shocking to most people when they visit the cancer hospital. And what they expect to see is they expect to see misery and they expect to see death and they expect to see depression. But instead of that, as Dr. Asma Hassan has eloquently mentioned in her journal, and it is also consistent with one of the most famous writers, Dr. David Hawkins, in his great book, The Transcending Level of Consciousness, has talked about people who can have a different level of consciousness and a different level of perception. And cancer patients, or a majority of them, as in Shaunna example, they develop an accelerated to a remarkable degree ability to shut down all the noise in the background, the noise that seek meaning in the material world, the noise of ego, the noise of pride, conflict, and self-serving behavior. And by doing that, they allow their true selves to emerge. They flourish spiritually and they radiate joy, peace, kindness, and positivity. And they understand very well the difference between surrendering and giving up. And they somehow develop a heightened sense of beauty and acceptance. And we see that repeatedly. Perhaps you are seeing this more obviously in Shaunna case, and this is what Dr. Asma has noticed when she met her in that garden. But this is something that we see with most of our patients. We, as oncologists, are always humbled, and we are always honored when we meet with our patients, as they remain to be our greatest teacher, not just in a matter of academia and disease and treatment, but they also teach us about the art of life itself. If we want to talk about GIST from a scientific point of view, and I will not elaborate very much on that, it is what is known scientifically as gastrointestinal stromal tumor, and it's a cancer of connective tissue. This cancer historically constitute what is known to surgeons and patients at the time to be a surgical nightmare, especially in stage 4. This cancer historically did not respond to any known chemotherapeutic agent at the time, and the patient who suffered from this cancer, they had to endure repeated agonizing surgical exploration of their abdomen because of repeated bowel obstructions or bleeding inside the tumor. The episode that Shaunna described in her speech about visiting the hospital and couldn't find a vein and found her in a state of almost shock. This is one of the incidences in which there is a spontaneous bleeding inside the tumor. So in the history of this cancer, patients has to go repeatedly a surgical exploration after a surgery, until in 2002, when a Greek American physician scientist, his name is George Dimitri from Harvard University, and his team, they introduced a simple oral tablets. It is called imatinib or Glivec, which was one of the first treatments Shaunna has started on. And this treatment has really changed the landscape of disease for every patient. It changed the landscape forever. Patients were able to remain healthy without the need for surgery for many, many years, even in stage 4 disease. So in Shaunna example, she is, since the late 2020, she's on an oral tablet also, but with a different mechanism of action. It is called Sutent. And as she mentioned, we had to go through a great deal to convince her to take the treatment, especially that it had some side effects. She generally prefers to take natural things. She doesn't prefer to introduce chemicals to her body. And Sutent is known to affect the skin, cause thinning of the hair, make the patient feel fatigued and tired most of the time. And this to a person like Shaunna is somehow is difficult. It's heavy. She's an energetic person. She loves to go outside. So we had to compromise on the schedule of the treatment, cut some days off, modify the dose, and it somehow managed to keep the disease under control for the past time. And I hope this will continue, inshallah, in the future. It is my belief, however, that it is her positivity and courage and strength that is the main reason that is keeping her standing today even more than the medications. And I encourage all patients, whether with cancer or not, to adopt such a spectrum of feeling and attitude. And it helps greatly with the disease, not only from a psychological point of view, but also from a physical, and it has been narrated in some literature. I will conclude, and I do not want to elongate or spend long time, spend a lot of your time. I'll just conclude with a final note. Cancer is just a disease, and it is not an identity. And this is very important for patients to understand that they should not define themselves by their cancer. It is very important for the family and the society also to understand not to define patients with their cancer. There is no boundaries for the human soul, and it is highly recommended, it is my recommendation, it is my advice to do exactly what Dr. Asma did. If you meet a person who has cancer, I advise you to take a few moments, start a conversation. You will not only be welcomed, but I guarantee that this conversation will have some effect on your life. I would like also students especially and all attendees, I would like you, if you have time, to go through a very beautiful biography written by Dr. Siddharth Mukherjee. It is called The Emperor of All Malady. He is an oncologist and a novelist from Harvard University. He will give you a great deal of understanding and depth in understanding cancer and the patients who are dealing with this. I'd like to thank you all for this event, and I would repeat again, this is an event I would really love if you can extend the invitation to all of the people in cancer fields, to all the oncologists here in NCCR. I think this is something that they would really love to enjoy. It saddened me that I cannot be there with you today to feel the atmosphere and the vibes and to get to know you in person, but inshallah this will happen in the future. Thank you very much. Thank you, Shaun, and thank you for the organizing committee.
Thank you, doctor. Thank you. Have a nice day.
How'd you guys feel? So we're almost done. This is just like the closing speech. And honestly, I want to take this opportunity to like brainstorm or analyze what we've all heard today. I think there are a lot of take-home messages. So it'd be nice to just think about things together. So the first thing I want to comment on is, let's all think about one special person in our lives that had a big impact on our lives. These people are probably a part of our lives because of one or many random sequence of events. And if for any reason, let's say a minor detail changed, they probably wouldn't be part of our lives. That could honestly change our lives drastically, don't you guys think? And when actually that concept in of itself, it's very astonishing, especially when you look at it macroscopically and you get to see how literally each and every person on this earth, they get to live by this concept. their lives are the way they are because of like each second and each detail counts. All of us here today, we wouldn't be here if that one specific encounter hadn't happened on one specific table at a random hospital on a random day between two strangers. And that's honestly mind-blowing if you ask me. Which brings me to my second point, guys, which is the importance of taking initiatives or saying yes to things. That's really important. This might seem a bit odd, like Asma didn't know Shaunna, Shaunna didn't know Asma. Asma just asked Shaunna, do you want to just talk in front of an audience? And Shaunna said yes. That's not something that we usually see. And getting out of our comfort zone is a really big part of growing as people, of building a personality. So this is like your daily reminder to always say yes. Say yes to the volunteering opportunities, say yes to the hangout, say yes to leaving your bed today, say yes to all the opportunities that you get, because in like 30, 40 years from now, when we're all old and too tired to move, we probably look back at these moments and we'd regret the things that we didn't do rather than the things that we did do, even if we don't end up liking them, because the things that we don't do, they lack the outcome for reflection. So that's very important. The third thing that I want to talk to you guys about, which is that through Shaunna's story, we all get to reflect on our lives. Evidently, no one has it easy. Some might have it harder than others. That doesn't mean that your experiences are invalid, but it's really important. As you guys saw, like Shaunna's spirit is amazing. She's an amazing person. She made us laugh. She made us cry today through her speech, and it was really amazing. And this isn't to say that it's not okay to feel sad or grief or anger, but rather to know how to channel these negative energies in a way to help you grow as people, to help you become better. Because I personally think that if it wasn't for Shaunna's amazing spirit, she probably wouldn't be here today with us to tell us his true story and to actually teach us what it means to be a true fighter. I want to conclude by what Dr. Muhammad said, which was about the importance of mental health. It is really important to take care of yourselves. Mental health is really important. It's like no matter what happens in your life, if your mental health is not okay, it literally doesn't matter. If you're doing well with a bad mental health, it doesn't matter. If you're going through a lot of problems and hardships and your mental health is okay, you got it figured out. So that's really important. Just a small break to ask Shaunna some questions. I don't know if we have some questions from the audience. Do we? Does anyone want to ask any question? Yeah. Please.
Well, first of all, thank you, Shaunna, so much for sharing your story and your journey. And, you know, I'm sure it was very difficult to put it into words, so I really appreciate that. I'm thinking about our students and what I would like them to take away, in addition to all the messages, the many wonderful messages you gave them. You know, you're giving us a very important perspective that sometimes our students don't necessarily hear or they don't focus on, because they're focused on, you know, the provider side, what they're supposed to be doing and so on. In your journey, what is one thing you wish your healthcare providers had known? One thing you wish that the doctors or the nurses, and you obviously, you know, spoke very highly of the care that you received. What is one thing you wish that they had known or you would have liked to tell them about you and about how to care for you?
Well, as I said, I will sit here. As I've said, I really do appreciate all of the healthcare that I've received from the doctors, and even, you know, even I don't question any of those. Because really, I am thankful 100% of Hamad Hospital and the doctors and the nurses that they exceeded my expectation for the healthcare that I have had. But one thing that I would want them maybe to consider is About I'm not sure if I will say it here, but this is an opportunity now to just to try or accept natural ways how to prevent or for the cancer. But for the healthcare, I don't have any question. But like Yani to prescribe, I know you cannot prescribe, but to allow a cancer patient or any uh, person with illness to take a natural way, in a natural way, to support them, like to add to the medication, it would be better.
This is a very important point. Shaunna, first of all, I want to thank you, actually. And this is the braveness. This is what get us off the bed in Cancer Society. This is what get us off the bed. This is what keep us in the office for hours. That doesn't matter what's the ending day of the work. We keep pushing till we make actually. I mean, I remember. I'm just gonna share here a story. I remember we had actually a Qatar University student needing a bone marrow transplant. That happened a few years ago. And to have the bone marrow transplant, they need to have a total of $500,000 real of their account to proceed with the transplant through charity. So we actually, all the team, the finance, everyone stayed, because to have a financial transaction, you have to keep it time. Because you cannot transfer, this is financial information, bank information, you cannot transfer the whole amount of money in the same time. So we kept 2 days, we kept working on this process till we make sure that they're in their account, they have that money. Without, doesn't matter, we were staying like really late till the bank closed, then we the other day till we maintained the transfers. So that's what pushed us forward in keeping, I mean, the journey, the giving you the smile, the happiness, finding the true meaning of life, get you over this hardship and the pain. The pain will continue. It's just how you get over it. And so first, I want to start with this, and this other point regarding contemporary medicine or natural medicine. I want to mention 2 points. One is actually, I agree with you. We need to work more. We need to have more education for healthcare professional, because that we need to learn from the Asian culture. And all the medicine came from a natural way, medication. And we need to do more research, more work on this. And I want to thank Qatar University. I know there was a couple of researchers working on actually invention of medication, like breast cancer, like an example, out of plant and natural way. So the other aspect I want to mention is actually, I wish, that's my wish, I wish all everyone involved in taking care of people living with cancer, they need to think beside the medication and providing treatment. They need to think of the holistic approach, the spiritual need, the family need, the supportive need. We need to it's not only like, as Dr. Muhammad mentioned, it's not a case, it's not a cancer patient, it's just a disease like any other disease. So the holistic approach is very important. And it's very important when you come and same thing when we have I mean, factors that affect in our study, the family situation, the everything, anything. Like, even sometimes you have to know, is the patient room cold enough, warm enough? I mean, this is all some simple stuff, but this is very important. And the other aspect you mentioned, I want to, in your story, like how they get the IV in, and I think Dr. Muhammad mentioned a point about the importance of discovery. Without Harvard discovery of this, the immunomodulators, the journey did not improve. And you guys, each one of you could represent one person or a team of scientists, will change the life of people completely. So I urge you to take this experience and getting the IV in. Now with the new advancement, now there is a new advanced technology, and we need to think of improving the technology for fighting IV, for accessing. I mean, there is work already happening in that experience. But as a future healthcare professional in the area, the narrative medicine or the stories, actually there is now, it's subject that people study, it's called narrative medicine. You learn more about the medicine from the journey of people with the disease, they're describing their experience, and you start to pick on areas that need improvement in the healthcare field. So that's another aspect I urge you to focus on, and read the book that Dr. Muhammad, the two books that Dr. Muhammad mentioned. Both of them will change. I'm sure after you read the book, next day, the other day, the following day, you will study more. You will focus more on your project. You will start to put like, I'm not, because you're gonna see the purpose why you are going to healthcare. Thank you.
Thank you, doctor.
Any other questions? No? Fine, I have a question. So, Shaunna, if you had one tip to give to someone who is newly diagnosed with cancer, or they know someone who is close to them who is newly diagnosed with cancer, what would it be? Just one tip, like one major tip, advice.
Well, what major to my experience, it is the acceptance. Because I know, even in movies, if someone will tell you are diagnosed with cancer, you'll be traumatized, you don't know what to do. Acceptance and fully surrender to God. Because we cannot question why me? Usually people will tell, why me? Why? Out of how many billion people in the world, why me? For me, I don't consider that question, because I totally trust God that in every situation in my life, there is a purpose. And if you will try to think of it that it has a purpose, you always need to search. In every details of my life, I would always say, especially the biggest ones, I would say, I talk to myself like that. I know it has a purpose. I must find it. And in that way, you'll be positive. You will not cry. You will not make too much drama. Just find the purpose in it. Thank you.
Can I? Yeah, thank you, Shaunna. I'm just gonna end this. Is this working? Yeah, the closing remarks, it's a bit long. Bear with me, guys. We have a lot of people to thank for this. So, yeah. First of all, we want to thank Dr. Hanan for being here today. Thank you for your constant support to the association. And actually, I don't know if you remember this, but this whole thing was actually your idea, if you remember. We had a meeting a few months ago. It was random. We were just brainstorming ideas for this year. We had a similar, but not quite exactly the same concept of this. And she just polished it, made it prettier. And she presented us with this final product that you guys are here to witness today. So thank you. We also would like to thank Dr. Hadi. Thank you so much for being here. We really appreciate, we love the presentation. We appreciate everything that you're doing for everyone here. You give us a reason to be better. You give us... Yeah. That would be good. Okay. We'll be back, guys.
The question says from Samira, what kind of approach should we take on educating families with people with cancer and on educating the general public in our society?
I think the question is for the doctors.
Very important question. So actually for the education, the point of how we, as a strategy, let's say my straightforward answer is in every point. In healthcare, we call what's called test point of service. Point of service healthcare exam is that at the point of whenever a patient encounter, you remind them of everything about health. But in the community, I say we do the same thing. We need to do in every point of service, at work, at school, in, let's say, in public events, in every point in media, in social media. So the education, it need to be our goal, we need to move the health to be on the top of our mind. I think one of the silver lining of pandemic is actually made health on the top of the mind of everyone in the world. And I think we need to benefit and invest on that momentum and move it forward.
The other question, what could you tell us as students to help anyone with people with cancer in our studies or interactions, like the way we speak about cancer or our approach in talking about it?
So about speaking to people living with cancer, I think Dr. Muhammad said it 100% is don't treat cancer patient as a person with disease. They are individual, they are human being. And I think we need to more and more adapt the concept of people living with cancer. I'm a person living with disease, but I'm a person first. Yeah.
Thank you for the question. I think I also want to pick up on Dr. Muhammad's excellent point, which is that you have to listen. This is what I'm telling you as healthcare students, is you have to listen and you have to incorporate that into your interaction. And he gave you an example. So he said, you know, for Shaunna, it was important to remain active, to maintain a certain quality of life, of lifestyle. So we adjusted how she was given the medication. The schedule was adjusted so that allows her to continue to be active. And what he did there was he was listening to what was important to Shaunna. She told them, that natural remedies are important to her. Whether, a physician agrees or doesn't agree, it's important to know that and to know if she's taking anything, to supplement her treatment, because in the end, they're all working for the same goal, which is, to give you a successful treatment and a good quality of life. So if you were to go away, and this is our hope for conversations like these, if you are to go away with anything, it's the importance of listening, of understanding what's important to others so that you can incorporate it in your interaction.
Thank you, Doctor.
And I think I will add also is we need to think of person-centered care in everything. So every person, they have their own unique need, their own unique situation. And also the other point that is, I was discussing with Dr. Hanan is the equity. Everyone fairness is not to give everyone the same level of care. That's not fair. You need to understand the concept of equity. What I need is different than the other need. So that's another topic to maintain always when you're thinking of dealing with people living with cancer and how to be fair to them.
We go back. Are we done with the questions? Okay. Asma, can you please grace us with your presence? Okay. Again, Dr. Hanan, thank you. Can you please welcome us on stage? Back pictures.
Good question. Thank you so much. Thank you. So much.
Dr. Hadi, please.
I don't know where is my good side. I never make good pictures. بالعكس شكرا لك.
Doctor, your take on personalized healthcare?
Thank you. Okay.
Your take on personalized healthcare was really interesting. Thank you so much for that. Who else? I mean, yeah, we're supposed to, Dr. Muhammad, but he's not here. Thank you. Thank you very much. Yeah. Yeah. Shaunna, thank you so much for being here. You're our hero for the day. Come. being here. نسيم بعدين احنا بعدين طولنا شاهد بعدين عندك ورقة شاهد اوكي شاهد. We would also like to thank Ms. Shahid for helping us through this. Can you please come? Ms. Shahid took care of the communication. She made it so much easier for us. She paved the way so we could have a smooth ride. Thank you so much. And such a short notice, she took care of many things. I don't know how you did it. You're actually a hero. She is. Oh, she's not here. Finally, I would like to thank the CHSSA team, the volunteers. Thank you guys for saving us. I know it's midterm season, so it must have been really hard for you guys to attend, whether in person or online. Thank you so much for taking the time of the day. You're the reason we do these events. You're the reason we strive to be better. Just stay tuned. We got you.